Hi, I'm Jen. As a mother of three teenage daughters and a seventh grade reading specialist and gifted teacher, I faced my share of challenges, including living with chronic graft-versus-host disease, or cGVHD. My journey hasn't been easy. After battling cancer and undergoing a bone marrow transplant, I was diagnosed with cGVHD. Adjusting to life with this condition was overwhelming. And while my husband, daughters, and oncologist were a great support team, I initially struggled with my cGVHD because the treatments I was taking were not effective for me. Fortunately, after discussing other treatment options, my doctor prescribed a medicine called REZUROCK. REZUROCK is for patients 12 years and older with chronic graft versus host disease after two prior systemic treatments did not work. Please see full prescribing information at the adjacent link. This was a major turning point in managing my cGVHD, and I'm grateful that I spoke with my doctor to find a treatment that works for me. Talk to your doctor about your options and to develop a treatment plan that works best for you. The most common side effects of REZUROCK include infections, tiredness or weakness, nausea, diarrhea, shortness of breath, cough, swelling, bleeding, stomach, abdominal pain, muscle or bone pain, headache, and high blood pressure.
Important safety information. Before taking REZUROCK, tell your healthcare provider about all of your medical conditions, including if you have kidney or liver problems, are pregnant or plan to become pregnant. REZUROCK can harm your unborn baby. If you are able to become pregnant, your healthcare provider will do a pregnancy test before starting treatment with REZUROCK. Tell your healthcare provider if you become pregnant or think you may be pregnant during treatment with REZUROCK. Females who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Males with female partners who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Are breastfeeding or plan to breastfeed? It is not known if REZUROCK passes into breast milk. Do not breastfeed during treatment with REZUROCK and for 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. REZUROCK may affect the way other medicines work, and other medicines may affect the way REZUROCK works. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. How should I take REZUROCK? Take REZUROCK exactly as your healthcare provider tells you to take it. Do not change your dose or stop taking REZUROCK without first talking to your healthcare provider. Take REZUROCK 1 time a day with a meal. Take REZUROCK at about the same time each day. Swallow REZUROCK tablets whole with a glass of water. Do not cut, crush, or chew REZUROCK tablets. Your healthcare provider will do blood tests to check your liver at least 1 time a month during treatment with REZUROCK. If you miss a dose of REZUROCK, take it as soon as you remember on the same day. Take your next dose of REZUROCK at your regular time on the next day. Do not take extra doses of REZUROCK to make up for a missed dose. If you take too much REZUROCK, call your healthcare provider or go to the nearest hospital emergency room right away. What are the possible side effects of REZUROCK? The most common side effects of REZUROCK include infections, tiredness or weakness, nausea, diarrhea, shortness of breath, cough, swelling, bleeding, stomach, abdominal pain, muscle or bone pain, headache, high blood pressure. Your healthcare provider may change your dose of REZUROCK, temporarily stop, or permanently stop treatment with REZUROCK if you have certain side effects. REZUROCK may affect fertility in males and females. Talk to your healthcare provider if this is a concern for you. These are not all the possible side effects of REZUROCK. Call your doctor for medical advice about side effects. Use. REZUROCK, belumosudil, is a prescription medicine used to treat adults and children 12 years of age and older with chronic graft-versus-host disease, chronic cVHD, after you have received at least 2 prior treatments, systemic therapy, and they did not work. It is not known if REZUROCK is safe and effective in children less than 12 years old. Please see full prescribing information at the adjacent link or at REZUROCK.com. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Cadman Pharmaceuticals, LLC, a Sanofi company, at 1-800-633-1610 to report side effects.